And you've got your lumbar, the degenerative disc, mostly, all the bottom levels, which is common.
Yeah.
Your bone 3 tilts on bone 4, which gives you that curve. That's arthritic in nature, not going anywhere. But that's just those changes there.
Okay.
So that's your x-rays. And we get updated imaging because it's just necessary for many reasons. And the only thing we have left to update on you is we have x-ray, standing, skeleton. We don't need joint MRIs. That's Dr. Blocker if he wanted, you and him wanted to, but we would get the MRI updated of your lumbar.
Yeah. And I don't know when I am due for the shot in the lumbar. Again, it's usually quarterly, every 3 months or so.
Yep.
And I don't know, it should be coming
Is
up.
your pain needed?
I still have pain, mostly at night.
Okay.
It's not severe, so I can't really claim dire need.
Okay, fine. When you're ready, we'll go with it.
Okay, all right.
I just have to type it in.
I do need
Go with a refill?
The medication's going.
Yeah,
Oh,
I need
I
a
knew.
refill on the medication.
We're doing an injection.
Oh, a new injection.
Right.
Yeah, so she's out of pain pills today.
So we send the medication. The medication goes the same day that I see her.
Okay,
I send the medication when I see the patient,
fantastic.
and it's due when it's due. So if it's due today, then great. Your epidural was October 29th. So you know what? October, November, December. So January-ish we can, so next visit, if your pain wants to, we'll go with that repeat if we need to.
Okay.
If we don't, we don't.
I don't know whether to say yes or no. I think it did help.
Sure.
And so it's, I think, kind of foolish to say no if it's available.
Yep. We'll get it ordered the next visit. We gotta give it that 3 months. And so sometimes it takes 2 buckets of water on the fire to quiet it down.
Yeah, I know.
Sometimes 2 doesn't touch it, and we tell you to get a 3rd when 2 didn't help. So it kind of looks like, you're selling injections here. But it's a science, it's a fact. 1 injection might be the charm. So we don't do the other ones and waste them.
Well, I know it's
So all
a
of
very
those stories.
minute target too. It has to hit the right spot in the nerve in my spine.
Mhm.
So she has this old medicine that she says has been discontinued, tramadol.
Right.
Now that's the acetaminophen.
We write hydrocodone to her, which is hydrocodone and Tylenol pill.
Yeah.
We would not want you to use tramadol.
Yeah, it's
If
fine. I don't have any of it. It's,
So, tramadol is less potent, different compound, but we've been using
I took it
hydrocodone.
off the market or something.
Tramadol's not off the market.
It's not, I
No,
thought they
ma'am.
took it off and
She's
replaced it
got a
with
bunch of old
hydrocodone.
pills in her.
So we don't want to use old pills because of, I know that we're safe, but if tramadol shows up in the urine when we're not actively prescribing it, it's a negative in the chart.
Yeah, these are all empty bottles because she thought she needed to keep those.
Well, it's a record file cabinet for me. This is what I used to take.
That's in the national database and in our charts, but
Yeah.
so I would just, don't use the tramadol, just use what we.
Not only do you not need the bottle, you don't need to take it anyway, even if you had some.
Todd,
So she won't
allow
do
me a
that
few
stuff.
quirks.
She's confused. She's way off her schedule.
No, I don't.
So
Todd,
it's kind of like somebody has, listen, it's case per case and different. I know that she's not trying to, party on the pills and take them and do this, but it just, the chart doesn't know that. The chart will see, we're not writing tramadol, or maybe we used to, but now here's tramadol and hydrocodone in the system. So that's a negative on a urine drug screen because, follow the rules thing and so
I don't
forth.
take tramadol anymore.
Right,
They
no,
took it off
get rid of the
market.
tramadol.
It's gone.
Yep.
I don't have it anymore.
Yep. If you said to me in the future tramadol helped you, you tolerated it, you'd like to go back to it, I'll stop hydrocodone and go back to tramadol. So just just leave it.
Get rid of it.
Get rid of it.
Normally, I don't take the pain medicine necessarily twice a day. I don't take it
Good.
morning and evening.
So it's not something that's a routine. Take it away and
PRN,
take
as needed.
as needed.
Yeah.
It's not something
The
that
word
you
as
just-
needed is on every opioid, except for
Yeah.
extended releases.
Yeah, it says as
Good,
needed.
because they get a tolerance built up and it doesn't work anymore. And yeah.
And some people don't get a tolerance. They stay well hydrated. They use the PRN med, PRN, and not when the clock strikes 10.
So we thought she was getting off her schedule.
Okay.
But she's supposed to just take it when she has symptoms. When she
So,
has pain.
so it's an as-needed medication. So sometimes if we get in a flare, we want to stay maintenance dose.
So that's the
So
time
then
they
you would
take
run the as-needed medication
a course of
accordingly. But if this is a hit or miss, it's a hit or miss on taking the pill.
Yeah, I don't take it morning and night unless I'm in a cycle that I'm really having a lot of pain at night. So I may take it at bedtime, but not necessarily in the morning.
That's wonderful.
What happens if you take a sleeping pill with that?
So opioid and sleeping, so you want to keep those separate.
I do use the sleep aids often.
A lot of patients have sleep aids and opioid. You don't, so technically they tell you don't swallow it at the same time. If you did, would something happen to you? Probably not. Okay, it's just, it's a formality.
I got you.
But so someone who has a lot of opioid on board and a sleep aid, just say it was a benzo, because the benzo and the opioid are the medications where the people never woke up.
Okay.
That is real.
Yeah.
And that's it. It's over. They shut their central nervous system down and died in their sleep. That's real and huge. But that's it. That's dosing that has been taken a pill in the morning. They kept morning, evening. The maintenance level just kept going up, and the central nervous system went bye bye.
Yeah.
So that's that per. You take a sleep aid 3 hours after you took an opioid. Not the same story.
Yeah.
Just be cautious.
The pain pill,
So I'm gonna send the hydrocodone. I'm sorry, go ahead.
it's usually morning and evening,
Yeah.
twice a day. And that would be first thing in the morning, and I don't necessarily double it up in the evening when I'm gonna be using a sleeping pill.
Yeah. So the Q12 hours used to be able to write it BID twice a day, meaning you could take it at 8 a.m. and you could turn right around and take it in 6 hours.
Yeah.
Because those medications can be written Q6 hours PRN pain.
Uh-huh.
They make us write Q12. When you have a 2-a-day dosing, yes, you're supposed to follow it twice a day, but that same medicine can be taken every 6 hours. So if you were to utilize your 2 medications as needed within 6 hours of each other, that is safe. You have to get at your own schedule. It's written. Does that make sense?
Yeah.
I'm not trying to confuse
Right.
anybody.
Right.
So definitely keep it away from your sleep aid.
I normally
Just
don't
because
take it
from
twice a day. I
Yeah.
might take it in the morning, but not in the evening.
Yep, you keep doing what you're doing. Same thing. I'm going to send you hydrocodone. We'll talk about the epidural next visit, and I'm going to order a lumbar MRI at Buford Memorial.
Okay.
They are overbooked. So you call Buford Memorial Main Hospital in about 2 weeks.
Let me ask you something.
If they don't call you,
I
and
wish
then
I
you
brought it
schedule
with me.
conveniently. If it's in January, late January, fine, because they're booked. But I do want you to call them if they don't call you in 2 weeks.
What I'm trying to tell you is
Uh-huh.
I think I just had that done.
An MRI?
I think so. Because I got an invoice for $1,600. Yeah.
Sounds like it.
Uh,
But do you remember being in an MRI tube?
it
At the
wasn't
hospital?
huge, but I went to the x-ray place at Buford Memorial Hospital to have it done.
Of your
It
back.
was a stand-up,
I haven't ordered one.
it was a stand-up x-ray of some type.
I don't know what that is. I'll look in the system.
Okay.
Would that show up in her Buford record on her chart?
We can.
Hospital visit?
It supposedly was a,
It wouldn't until we go in to Buford because we are connected. Because of the MRIs and all that and stuff, so I like to plug into the BMX system and look.
supposedly it was a bone density test.
So that is not what I'm ordering. So
Okay.
I will get that, But so I'm gonna send lumbar MRI order to the hospital. You call them in 2 weeks if they haven't called you and get scheduled conveniently.
Okay.
I'll send your hydrocodone and follow up like regular for the med.
Can you send me, well, maybe a printout as a printing on my appointment reminders, but I need something that's a reminder on going to the hospital to have that x-ray done.
Sure, let me, yep,
That'll be when we leave.
to hold one right here and I'm gonna get that.
Okay.
Merry Christmas, nice to meet you.
Nice to meet you.
Thanks,
Yeah.
Linda.